pesos lang ang kalahatan kasi.
Hello, hello. Sorry for um, the technical difficulties, no? Um, yung ilan lang, sorry po kung ngayon lang ako nakakonect. Nagkaroon ng problem dun sa computer ko this afternoon. So, kaya naghanap ako na alternative para makapag-start tayo ng rationalization. Thank you for those who have the time to attend. I-message ko lang si Sir. Sir Ruel, please allow me to share my screen. So may mga representatives from um, University of Pangasinan. Meron ba? Cagayan de Oro meron. Ayan, meron akong nakikita. And meron din from University of Iloilo. Hello? Since iilan lang naman tayo dito, so I encourage everyone to participate kung ano nyo. Okay. So, I appreciate na magpa-participate kayo kasi hindi naman to para sa akin pero para sa inyo. And at the same time, use this time, no? Para hindi nyo nababalikan yung recording, no? It is just a waste of time. So darating yung time na hindi nyo na rin yan mababalikan, no? So make use of this time. Ito ay allotted time for you para mas ma-discuss, maintindihan nyo yung exam na tinake nyo last week at saka this week. Okay? So it's up to you. Pero just hindi lang. Ayan. Hello? Is anyone seeing my screen? Hello? So there are only one, two, one, two, three, four, five, 6, 7, 8, 9, 10. There are only 10 students present this afternoon. Malinaw po ba on your ends? Um, I assume malinaw, no? So, um, since no one is answering, I'll just start my rationalization. So, it's up to you kung kailan nyo papanoorin. Pero, I just want to clarify that you are not entitled to distribute the questions, no? So, it is only for your own purpose only, okay? So no part of disease exam may be reproduced or transmitted in any form by any means, electronic or mechanical, without our permission, no? Ng RGM Review Center and my permission. Okay? So number 1, so the drug that have almost exclusively harmful effects. A, toxin, B, poison, C, supplement, or D, diagnostic. So the answer here is poison. Since a toxin is usually defined as poison of biologic origin, no? Supplement is a drug that is used to support in order to fortify a general well-being, and a diagnostic is a drug indicated in a test for the determination of underlying illness. No? Like if we use edrophonium, no, for the treatment, for the diagnosis of myasthenia gravis, it can increase the activity or the energy of the muscle after administration of edrophonium, but it has no intention to treat the underlying illness. Number 2, the action of the body on the drug. A, pharmaceutical, B, pharmacodynamic, C, pharmacokinetic, or D, pharmacotherapeutic. So the answer here is letter C, pharmacokinetic, what the body does to the drug. The others, pharmaceutical is the drug itself for the diagnosis, treatment, or prevention of the disease. So pharmacodynamic, what the drug does to the body, as we all know, no? And pharmacotherapeutic is the effect of the drugs, no, in the body, either toxic or not. The only biopharmaceutics process. So the answer here is letter D, liberation. So as stated in our discussion, liberation is the first step in the determining onset of action, rate of absorption, availability, and so on. And it is the only biopharmaceutics process. Number 4, it is they are the proponent of the lipid bilayer theory. So they as you can see in the screen, there are lipid bilayers, no? It has 2 layers of phospholipids between 2 surface of proteins. And the hydrophilic head groups of the phospholipids facing the protein layers, and the hydrophobic tail groups aligned to the interior. So this is proposed by Debson and Dianelli, no? So next, number 5, the rate of diffusion is inversely proportional to what, no? So A, surface area, B, partition coefficient, C, thickness, and D, plasma concentration. As you can see in this question is based on the Fick's law. And as you can see, the rate of diffusion is inversely proportional to one factor, which is the thickness of the membrane. No? As you can see in the formula in letter H. Number 6, the organ with greatest passive transport. So the answer here is letter A. Lungs, no? It has 100% all organs, major organs. Kaya siya yung may greatest passive transport capacity. So next, number 7. In general, drugs should exist as blank in order to pass the lipid bilayer. A, non-ionized, B, ionized, C, zwitter ion, or D, all of the above. So the answer here is letter A, non-ionized. Sa mga okay ba yung phrasing? Kasi I assume, hindi ko alam kasi kung may nakikinig sa akin or what, but if you want me to slow down to discuss it more further, then please free to interrupt me, no? Sa mga nandyan. Pero kung wala naman talaga, it's okay. Pero kung if you want to ask me questions further questions, then feel free to interrupt. Pero kasi I assume wala kasi sumasagot sa akin, no? So the answer here is letter A, non-ionized, no? And it should be not ibig sabihin ng non-ionized, ibig sabihin non-polar din. So light dissolves light and it will pass to the lipid bilayer. Unlike kung ionized siya and may sweeter ion, no? So there's a tendency that it will not pass the lipid bilayer, no? Number 8. The one proof about facility transport except that it is the fastest transport system. So as we all know, the fastest transport system is active transport since it is energy requiring. It moves the gradient from an uphill character from a region of low concentration to high concentration. No? Of reaction is independent on the concentration of the drug remaining. So the answer here is, as you can see in the graph, no? So there also it uh, basing on the graph on the below, no? The rate is constant, no? As compared to the other orders of reaction. Therefore, the concentration, the rate of reaction is still the same. Number 10, the mode of transport used for moving large liquid pinocytosis. No? It starts with fluid or substances found in the extracellular fluid. It forms a invagination in the plasma membrane, no? Then then a vesicle will come inside the vesicle, inside the cytoplasm through a vesicle. So next, it is considered as the most important bioavailability parameter. So the answer here is letter C, AUC. No, as you can recall, AUC is the representation of the total integrated area under the plasma level time profile and expresses the amount of drug that comes into the systemic circulation after its administration. So the area under the curve assumes the total amount of the active drug, no, in a particular time, no, and it measures the extent of drug bioavailability. So next, number 12. In the plasma time curve, it is the maximum pharmacological response produced by peak plasma concentration of the drug. So the answer here, no? So ang tinatanong is the peak plasma concentration of the drug. So basing on the plasma time curve. So it represents this arrow, no? And the answer here is intensity. High peak of the area curve. Number 13. The drug is released only at some point after the initial administration. So the best answer here is, bakit sinabi ko best answer? Kasi pwede naman modified release, pero kasi we are looking a specific uh, some initial point after initial administration release of the drug delayed is I'm looking for a specific answer. The answer is a delayed for 14. So the drug concentration between minimum effective concentration and this maximum safe concentration. So the answer here is letter B, therapeutic range. So it is measured between the minimum effective concentration and the maximum slide and elimination combined known as letter A, disposition. So no other answer is accept. E and high solubility. So this is a question based on biopharmaceutical classification, no? Classification system, no? That depends on the solubility and permeability of the drug. We call in the this figure, no? That high solubility but low permeability. Number 17. So as you all know, no, PPRC, pero kasi si cimetidine is a enzyme inhibitor, no? Enzyme inhibitor. So letter A, cimetidine. So it refers to the process wherein the drug metabolite secreted in the liver as bile, stored in the gallbladder, and subsequently released in the duodenum, jejunum, and ileum, where the drug can be reabsorbed back to the systemic circulation and subsequently returned to the liver. So the answer here is letter B, enterohepatic recirculation. As you can recall in this figure, no, that drug once absorbed in the it enters the gastrointestinal tract, it enters the liver, then liver will it can it can the bile or anything the metabolites can be transferred to the tissues, no, and can be back to the tissue to the liver once again, or it can be directly eliminated, no, in the system. However, through the process of enterohepatic recirculation, liver circulates the metabolites, no, back to the gastrointestinal tract, no, for reabsorption. So next, number 19. The following are factors that increase the gastric and the gastric emptying time, except A, high protein and fatty meal, B, cold drinks, C, gastric ulcers, or D, stress. So the answer here is letter B, cold drinks. So it is the one that can decrease the gastric emptying time. Therefore, it can increase the absorption of of the drugs, no? Next, phase of clinical drug trial that determines efficacy. So the answer here is letter C, phase 2. Since phase 2 includes 100 to 200 volunteer patients with target disease, so it is usually done in specialty clinical centers like university hospitals with single blind with placebo technique, and it determines efficacy, no? Especially, no? So next, number 21. Diuretics target to A, decrease cardiac output, B, decrease total peripheral resistance, C, A, both A and B, or D, A or B. So the answer here is letter A. It decreases cardiac output, no? By decreasing the blood volume, no? So when there is decreased blood volume, there's a decrease of blood of the cardiac output. So the adverse effect or side effect, the drug with side effect of pre-bulk hypertension. A, methyl-dopa, B, clonidine, C, terazosin, or D, hydralazine. So the answer here is letter B, clonidine. Both A and B are classified as alpha 2 agonist, no? Terazosin is an alpha 1 blocker. Hydralazine is a nitrate. So beta blocker with next number, beta blocker with intrinsic sympathomimetic activity. So the answer here is letter B, timolol. So timolol as well as pinolol, pendolol, penbutolol, acebutolol, carteolol, and labetalol are with intrinsic sympathomimetic activity with characterized to stimulate beta adrenergic receptors and oppose the stimulating effects of catecholamines in a competitive way. So through this, it can maintain the satisfactory heart rate in patients, and it can also prevent bronchoconstriction. So number 24, the beta blocker with vasodilator effect. A, betaxolol, B, nebivolol, C, bisoprolol, or D, carvedilol. So the answer here is letter B, nebivolol. Number 25, chlortalidone with, is classified with what type of diuretic? So chlortalidone, no, is not the usual, so has no sufficient as the usual suffix, no? So dapat alam nyo na yan, you should be cautious, no, when answering this type of question. Kung hindi nyo talaga alam, no? So the answer here is letter B. It is a thiazide diuretic, no? So you can find clues, no? Pwedeng chlortha, thiazide, no? Pwedeng yun. Or, no? So usually kasi may mga suffix na common din sa mga groups na yan. So mga potassium sparing like spironolactone, amiloride, loop diuretic like furosemide, osmotic diuretic like mannitol. Number 26, side effect include hyperkalemia. So I'm not speaking that it is the only with hyperkalemia. As you can see, all of the choices are known diuretics, no? But who among them has a side effect of hyperkalemia? So the answer here is letter D, amiloride, since it is a potassium sparing, no? The calcium channel blockers. Ibig sabihin ng prototype, so the first in the group, no, to be discussed. Number 28. So the answer here is letter D, ACE inhibitors. So as you can recall, no, that ACE inhibitor blocks conversion of inhibits two, no, angiotensin 1 and angiotensin 2 angiotensin 2. And no, when ACE is it the lungs to release irritant fibers that causes dry cough. Number 29, a selective renin inhibitor. So the answer here is letter C, aliskiren. Or with its known as number 30, vasodilators like hydralazine mechanism of it relaxes the arterial resistance. So the option A is more of a beta blocker. Letter B is more of the mechanism of a diuretic. A vasodilator that can cause hyperglycemia. No? So previously ginagamit to pero ngayon hindi na, no? Pero the answer here is diazoxide. Letter C. Number 32. It is contraindicated in the management of acute heart failure. No? And the answer here is letter B. Beta blockers. So during times of congestion, no, or acute heart failure, we are not giving beta blockers as not to allow no further congestion, no, and bronchoconstriction in patients with heart failure. Number 33, the drug of choice for pins metal angina. So it is not a particular drug, but more of a group drug of choice. But the answer here, so the answer here is letter C, CCB, all calcium channel blockers. Number 34, it is an anti-anginal drug that partially inhibits the fatty acid oxidation pathway in the myocardium. So nasabi ko yan ng lecture natin, no? It is trimetazidine, no? It is yan yung magbibigay ngayon to para mawala yung mga chest pain ng mga patients, no? But this practice is not universally accepted, no? Since sa US hindi siya masyadong ginagamit for this indication. But here in the Philippines, binibigay yan sa maraming patients. Number 35, in the management of ischemic heart disease, the strategy include, no, A, increase oxygen delivery by the nitrates. B, to increase oxygen delivery by the calcium channel blockers. C, to decrease oxygen demand by beta blockers, or D, all of the above. So the answer here is letter D, all of the above. Since all in ischemic heart disease, we want to increase oxygen delivery in the heart especially. And it is done by nitrates and calcium channel blockers. And at the same time, to decrease demand by decreasing the heart rate. And it is done by the beta blockers, no? So number 36, the calcium channel blocker that is selective for cerebral blood vessels. So the answer here is letter A, nimodipine, no? It is usually given to patients suffering from or who have suffered from hemorrhagic stroke, no? This is to to regulate yung the receptors in the blood vessels of the brain. So number 37, early rapid repolarization is what phase of myocardial action potential? So the answer here is letter A, phase 1 reaction. As you can see, as you can recall, no, in your handouts, no, that phase 1 is the early rapid repolarization, where it is described with decrease, no, and there's a increase in potassium. There's a beginning potassium efflux, no, and a decline since only the calcium causing the influx of there's only uh, influx of calcium, no, and the sodium influx in the cell decreases or has been blocked na or stopped. Kaya nangyayari, pababa siya, no? Pababa siya on this level. So number 38, the drug acting on sinoatrial automaticity. So the answer here is letter A, ivabradine. So ivabradine is currently categorized as class 0, no, based on the new classification of arrhythmia, no. So number 39, it is an anti-arrhythmic drug initially categorized as beta blocker, now classified as potassium channel blocker, no. So the answer here is letter C, sotalol, no. So sotalol is more of a it is initially classified as a type type 2 blocker, no, under the beta blockers. However, on further studies, no, it shows that its characteristic is dual in nature and it performs more of a calcium channel blocker than a sodium channel blocker. Than a beta blocker, I mean. So it is reclassified as group 3 antiarrhythmic drug. Number 40, side effect with synchronism. So the answer here is letter B, quinidine, no? As you can recall, it is from cinchona bark. Kaya synchronism. So it is presented with a variety of non-specific symptoms and when not controlled or not prevented, it can lead to death, no? So number 41, anti-arrhythmic class of undesirable property of reverse use dependence. So it can be found in letter C, potassium channel blockers. Number 42, an anti-arrhythmic use for prompt conversion of paroxysmal supraventricular tachycardia to sinus rhythm. So letter A, adenosine, letter B, amiodarone, C, magnesium, or D, verapamil. So the answer here is letter A, adenosine. So early today you just maybe you just want to see how this drug works. Chat box. Ayan. Ayan, baka gusto niyo makakita ng ano ng on how um adenosine works, no, in changing. Medyo pangit lang kasi yung quality ng ano natin ng Zoom dito, ng ano ko ng we'll just try. Ayan. Okay, nakikita nyo ba siya? So ayan, ang ginagawa is may patients na may
Yeah, whatever. Well, it's not taking his blood pressure. Oh, that's okay. All right, sounds good.
so yung patient MDKA changes, arrhythmic
That's
cardiac
6
listening,
milligrams.
Yep.
no? So yan.
And
So
remember, you
nakita
might feel that funny feeling
identify
in your
ng
heartbeat
doktor
discuss
na
once you get the medicine, okay?
ano siya, no? SVT o supraventricular tachycardia. Based on the ECG monitor. So mag-a-add
Say when.
ng adenosine.
Ready?
So ang yung nasa right, yun yung adenosine, pero kasi kailangan mag-bolus ka rin ng 20 ml of plain SS. So makikita nyo, no, pagkabigay, no, mag-treat, babagal yung
Not slow, yeah. And let your
ECG niya, no? So maging mabagal na yung heart rate ng patient, which is at around less than, ayan, bumaba